Welcome to the Allergy, Sinus, and Asthma Family Health Center, owned and operated by Francis Edward Newsel, ARNP, BC, with 16 years in the experience of treating allergy and asthma symptoms. He works with nurse practitioner Jeremy Snyder to treat patients in the Villages, Florida. The Allergy, Sinus, and Asthma also offers chemical patch allergy testing, in which you are tested for 36 chemical allergens with 3 patches placed upon the back. You come in for a period of 3 days as well as 7 days after to assess reactions. The Allergy Center also offers skin prick food testing, where you are tested with 3 different types of meat, 5 different poultry, 4 forms of dairy, 13 different seafood and fish, 16 different vegetables, 12 fruits, 6 nuts, 10 grains, and 16 molds. Other forms of allergy testing are what's known as the scratch test inhalants, in which you are tested for environmental allergens such as different trees, grasses, weeds, and common inhalants such as cat, dog, house dust, and flea. This is a 2-part test in which the second part is the intradermal, in which case anything you are not responsive to on the scratch prick test will be tested with needles slightly under the skin. Now, when you sign up to get your immunotherapy after being allergy tested and we come up with your customized formula, what you will be asked to do is to come in on twice a week basis at a maximum with a day in between, possibly once a week depending on your response or tolerance to our immunotherapy. When you sign in, it's no appointment needed. Walk in during the course of the day that we're open. You will be given an allergy shot evaluation form. This gives you a chance to be evaluated before you have your immunotherapy shot to prevent any adverse reaction or possible need for reformulation. It allows you the chance to have an EpiPen, being so we are giving you what you're allergic to. The other thing that it will allow you to do is, should you feel like you may be ill or not well enough to receive your shot, you should be evaluated by a healthcare professional to go ahead and allow yourself the access to your immunotherapy. Inhaled medications are essential in preventing and treating asthma, but the medicine is only effective if you use your inhaler correctly. Without proper use, your inhaler might not deliver enough medication to your lungs to control your symptoms. In order to properly use your inhaler, follow these steps.
Okay, so to begin, we're going to start with a meter dose inhaler like the Ventolin or any albuterol inhaler that you would use as a rescue. Allan here is going to help us demonstrate the use of the albuterol inhaler. So first, you're going to start by taking the cap off of the inhaler. Next, what you're going to want to do is shake the inhaler for 5 seconds. Now, with your fingers positioned the way Allan has, with your index finger on top of the vial and the bottom and your thumb on the bottom of the inhaler, you're going to put the inhaler to your mouth and you're going to breathe all of your air out first. Exhale completely. Then, putting the inhaler to your mouth, you're going to inhale as you press down on the canister. Take a deep breath in and hold. Hold for 10 seconds if possible. And exhale. Then repeat as necessary. Exhale completely. Mouth around it. Breathe in. Hold for 10 seconds. Okay, so now we're going to demonstrate the same meter dose inhaler with the use of a spacer. So, what you're going to do first is, with the inhaler, remove the cap. Now, you're going to shake the inhaler for 5 seconds. Now, placing the mouthpiece of the inhaler into the opening of the spacer until you get a snug fit, like so. You're going to remove the cap from the spacer. Then, you're going to put it to your mouth. Using the same technique, you're going to exhale completely. Put your mouth to the spacer. First, press the vial. Then, breathe in a nice, slow, steady motion until you've completely inhaled, and you're going to hold for 10 seconds. And exhale. Okay, so the next thing we're going to use is a nebulizer for nebulized medications. So, this is going to come in a couple of pieces here. So the first, what you could see in the middle there, that is the nebulizer compressor. That is what's going to actuate the medication. So you're going to start by plugging in your nebulized unit. Now, while each nebulizer is different, what you're going to do is you're going to open the nebulizer. And as you can see, on this particular model, you have a little cap, and that is where the nebulized circuit is going to be attached to. So now in the nebulized circuit, what Allan is holding, this is where the medication goes in. As you can see, in his right hand is the cap that will affix to the actual nebulized unit, and then in his left hand is a chamber that you will put the nebulized vials of medications that you have in. So to begin, Allan will place the green side of that green cap into the nebulized unit. Now, holding the chamber upright, you're going to take the medications that will come in the vial, you're going to break the top off of it, and then you're going to squirt the entire thing into your chamber. Holding it upright, then you're going to take the top and you're going to screw it in. Now, as you can see, the top has two pieces to it. You have the mouthpiece on one side, and then you have the outflow track on the other. So what you're going to do is you're going to begin by placing the mouthpiece in your mouth and turning on the unit. You're going to hear the medication, and you will see it coming out of the outflow. With this, you're going to want to take just normal breaths through your mouth and actuate the medication. Then, once the medication is complete, you will turn the nebulized unit off, and you're going to open the circuit. And then with the circuit, after each use, you're going to want to thoroughly rinse and dry your circuit for subsequent use. So with this, very easy, you're going to rinse it out with water and
Completely dry it before putting it away.
Okay, so to begin with, another meter dose inhaler that you will see fairly commonly is the Respimat. So to begin, the Respimat comes in 3 pieces out of the box. As you can see, you have the inhaler, you have the canister of the medication, and you have the cap. So Allan is going to demonstrate how to begin using the inhaler by putting the canister into the inhaler and then actually using the inhaler itself. So to begin, you're going to take the inhaler and then you're going to remove the cap, place the canister in with the hole going into the actual inhaler, and you're going to push until you hear an audible click. Then you're going to put the cap back onto the inhaler until you hear a click. Now you're going to remove the dust cap. And as you can see on the front end right now is the button that will actuate the inhaler. As you can see, it is depressed because the inhaler has not been activated yet. So Allan will now twist the bottom part of the inhaler 180 degrees, and that will cause the button to pop up. So now the inhaler is ready to use. So to begin using, it's using the same technique. You're going to exhale completely. He's going to place the inhaler to your mouth, and you're going to press the button to actuate the inhaler as you inhale deeply. Once you have inhaled completely, you're going to hold for 10 seconds. And exhale. And with this, you may repeat as necessary. Okay, now using another type of inhaler called a DPI, or a dry powder inhaler, we're going to start with a discus, as you would see with Flovent or Advair. So to begin, Allan has a disc. As you can see, on the right side, you have a divot for your fingers. So what you're going to do is you're going to slide the inhaler all the way across, which will open up the mouthpiece and the lever on the side. Next, you're going to take the lever and you're going to push it down until you hear it click. Now, the difference between the dry powder inhalers as opposed to the meter dose inhalers is that with the dry powder inhaler, you're the one actuating the medication. So with this, it will not push any medication out. It depends on your force of inhalation. So what Allan's going to do is he's going to put the mouthpiece, first you're going to exhale completely. Now he's going to put the mouthpiece to his mouth, and you want to get a good seal. Then you're going to take a nice steady deep breath in. This way you're going to allow the medication to go to your lungs, and you're going to hold it for 10 seconds. At the end of 10 seconds, exhale, and then you're going to return the inhaler to its original position by sliding the piece all the way back. Then with the dry powder medications and the dry powder inhalers, you're going to want to wash your mouth out with an acidic fluid such as juice, soda, or Listerine. Okay, so another dry powder inhaler that we have as an option is called Spiriva. Spiriva is a little bit different, although it keeps the same qualities of the other dry powder inhalers such as Advair or Flovent. So to begin, this is what the Advair Handy Inhaler will look like. So what Allan's going to start by doing is removing the dust cap from the inhaler. As you can see, once the dust cap is open, it will reveal the mouthpiece. Now, the difference with Spiriva is that Spiriva is going to have the handy inhaler, and it's going to have the capsules that will come in a blister pack. So what you're going to do is you're going to take one of the pills from the blister pack, and make sure, do not swallow the pills. These pills are made to be inhaled, not to be swallowed. So, Allan's going to open the mouthpiece, which will reveal a spot for the pill to go in. Now, it does not matter what end the capsule goes in, you just want to make sure that the capsule goes inside of the actual inhaler. And you'll be able to see the pill in the inhaler. Now what you're going to do is you're going to close the mouthpiece. You're going to leave the dust cap open. So now Allan is going to show you the green button on the side. Now you're going to press that in. What the green button is going to do is it's going to puncture the pill. Once is enough. So now what you're going to do, like any other inhaler, is you're going to start by exhaling completely. You're going to put the mouthpiece to your mouth and make a good seal. The key to this medication is to really inhale to activate the medication to your lungs. So you're going to take a deep, steady breath in and hold. As you can hear the sound of a vibrating pill. That is what you want to hear if you're doing the medication correctly. Now, after 10 seconds, you're going to exhale. And you're going to open the mouthpiece once more and remove the pill. And if desired, you will see that the pill has been emptied. Then you would dispose of the pill in the correct fashion. Okay, so the next dry powder inhaler we have is one of the newer ones called an Ellipta. This one you'll see with Brio or Noro. So to begin, this is what the Ellipta looks like if you'll flip it up around to show the counter. So as you can see, nice big counter so you can see when or how many actuations you have left of the inhaler. So to begin, Allan's going to take the top part and slide it down to the side until you hear it click. This will expose the mouthpiece. So like with the other inhalers, you're going to start by exhaling all of your air. You're going to put the mouth around it, and with it you're going to take a nice deep inhalation in. And then hold for 10 seconds. After 10 seconds, exhale completely. And then the top of the inhaler will click back onto the top. Okay, our last dry powder inhaler that we have is what you would see with there is Asthmanex, and then the other one is your Pulmicort. So to begin with this one, you're going to take the cap off of it. It's going to be a simple twist, and as you can see, that will reveal the mouthpiece. Now what you're going to see, as you can see in the front of it, is the counter. That will let you know how many actuations you have left in the inhaler. So to begin, Allan's going to take the top part of the inhaler and twist it 180 degrees until you hear it click. Okay, now what you're going to do, like every other inhaler, begin by exhaling all of your air. Now he's going to put his mouth to the mouthpiece and make sure you have a tight seal. You're going to take a deep breath in. And hold for 10 seconds. At the end of 10 seconds, exhale.
Hello everyone, my name is Allan, and I'm the practice coordinator here at the Allergy, Sinus, and Asthma Center. The first thing I'm going to show you today is how to use a nasal spray. Now, before you use any nasal spray, the goal is to prime it. You're going to take the top off. It will look similar to this, and what you do is with your ring finger and your middle finger, go ahead and place it right on the nozzle with the thumb on the bottom, similar to an inhaler. When you go ahead to prime it, give it a few sprays so that you get a fine mist coming out of it. When you use your nasal spray, you want to go in the nostril, out towards the eye, and like so. And apply to each nostril. Reapply as your medications direct you. Dr. Noozle's Irrigator Nasal Spray is an all-herbal, natural nasal spray that is not a medication, but more of a cleansing spray. It's something you would want to use after entering your home from the outdoors, which time you can actually clean the allergens and pollen from your nose. You can use it 1 to 2 sprays in each nostril up to 6 times a day, and it is approved down to the age of 4. Dr. Noozle's Irrigator is available at the office to buy before or after your appointment, as well as in other Walgreens in the area and Lake Health Nutrition, as well as on our website. Here at the Allergy Center, we offer many different vaccines, such as the Zostavax vaccine for shingles, influenza, and the pneumococcal vaccine, and now we even offer the Prevnar 13. All followed by the CDC guidelines. Please talk to your provider for more information. The Allergy Center also performs pulmonary function testing, a complete test to evaluate total lung function such as total lung capacity and lung diffusion process. This is a test done once a year and is trended over the different times it is done while a patient at the Allergy Center. Xolair, also known as omalizumab, is an IgE-mediated therapy that is administered at the Allergy Center for moderate to severe asthma as well as chronic idiopathic urticaria. The Xolair plays a part in the IgE response that is produced when an allergic reaction is initiated. Please speak with your healthcare professional for further information on this therapy.